Greetings. My name is Bishop G.C. Smothers. I am one of 9 elders at the Hillcrest Church of Christ in Decatur, Georgia. We are blessed at Hillcrest with outstanding deacons and a marvelous membership. But we're also blessed with a great team of doctors and nurses and essential employees on the front line of this COVID-19 pandemic. On Sunday, March 15th of this year, we gave a joint presentation on COVID. Then we gave a Q&A to the congregation, and finally we ended with a PowerPoint presentation on worshiping remotely entitled, "This Too Shall Pass." And you can find that on our website at hillcrestcoc.net. But back on March 15th, we only had 66 positive cases or confirmed cases in the state of Georgia, with only 1 death. As of today, 8 weeks later, we have over 31,000 confirmed cases with over 1,300 deaths. So we feel it is necessary to give an update to our congregation and any who would wish to hear on COVID-19. And so we've asked Dr. John Bonhomme, longtime member of Hillcrest over 22 years, to come and to again share what he would like to share and what he would like for the congregation and our viewing audience to know about COVID-19. In way of an introduction, Dr. Bonhomme earned his medical doctorate from the State University of New York, the School of Medicine, in 1979. Then in 1999, he earned his Master's of Public Health from the Grace Crum Rollins School of Public Health at Emory University with a concentration in epidemiology. He is currently an assistant professor at the Morehouse School of Medicine in the Department of Psychiatry and Behavioral Sciences. He has accolades. He's on the board of directors of the Men Health Network. He's the chairman of the steering committee for Community Health and Men's Promotion Summit. He's the president of the National Black Men's Health Association. He's been involved with providing prevention education to the homeless, providing anti-tobacco education to minority youth, counseling African-American veterans, providing prostate cancer awareness, involvement to fathers, and many, many other endeavors. And so without much more ado, I'm going to invite Dr. Bonhomme, member of the Hillcrest Church of Christ, to come and share what he would like to in way of an update on coronavirus, COVID-19. Dr. Bonhomme.
Greetings, Hillcrest family. I've been asked to give an update on COVID-19. I want to begin with some good news. They have discovered a medication that shortens the time of illness in a large clinical trial of about 1,200 people called remdesivir. So we are making a bit of progress against it. It was given to very sick patients and they got better faster than we anticipated, but we need to know more about it. We need to know more about when to give it. There may be other medications coming, but we'll get to that later. On the middle of March, we talked in the church about COVID-19. There were 45 cases in Georgia. Now, less than 2 months later, there's over 30,600 cases and over 1,300 deaths. Now, part of the enormous growth in cases has been the growth in testing, but even so, it's very clear that this is a virus that can spread very quickly and it needs to be respected. Nationally, 1,200,000 plus people have been diagnosed with COVID-19 with greater than 70,000 deaths. You can see a very rapid spread here, so this needs to be respected. But again, we don't need to panic about it. We just need to be informed about it and take steps to protect ourselves. I said in the earlier presentation that there were 2 epidemics, the epidemic of the virus and the epidemic of fear. Now there are 3 epidemics. We also have the economy. People are suffering because I believe over 30 million people are now unemployed, small businesses are closing, people are suffering financially, and difficulties with finance, difficulties with the economy can be very dangerous as the virus itself. There's also a mental health epidemic. Before it was just fear of the virus, but now people are suffering with isolation, with grief, with people that they've lost, with hopelessness because many have lost their jobs and don't know how they're going to continue. So we have a mental health epidemic on top of the COVID-19. There was a lot of controversy about Governor Brian Kemp opening Georgia, and was it too soon, but it's very difficult to balance the consequences of the actual illness, the virus itself, and the effect on the economy, because if people don't have a place to live, they can't shelter against it. You know, we have to balance those things, and there's a lot of different opinions about what the correct balance point should be. So I think that what we need to do is to try to gradually and carefully open up the economy and open up activities, but with protection, with being careful, with social distancing, with masking, with sanitizing, hand washing, sanitizing commonly used surfaces like doorknobs and things of that nature. So I think we need to gradually and carefully in selected areas try to open up again and try to get things moving. I said early on in the first lecture, what we knew about it at the time was that the symptoms were from the neck down, cough, fever, and shortness of breath. We've since learned that it can also present in other ways. Some people will develop belly pain, nausea, diarrhea. Some people will get muscle aches, chills, and shaking chills. Interesting symptom that some people have is complete loss of the sense of taste and smell. And also, we learned that COVID-19 can cause blood clots. We know more about how the virus works and how it attacks the body. It can affect systems other than the lungs. We think of it as a lung disease, but it can also affect the heart, the liver, the kidneys, the blood vessels. It attaches to a receptor. All those spikes that you see on the coronavirus, that's how it attaches to cells. It attaches to a receptor called ACE2, often in the lungs, and it triggers an overactive immune response. Some of the people dying of COVID-19 don't have a lot of virus in their system, but their immune system is overreacting, causing inflammation. Inflammation is like if you slam your finger in the door, it swells up. Why? Because fluid gets into the tissues. Inflammation is heat, swelling, pain, and redness. When that happens in the lungs, when too much fluid gets into the lungs, oxygen can't get in. And that's what happens to a lot of COVID patients. But as I said, it can affect other systems as well. In the blood vessels, it can attack the lining of the blood vessels called the endothelium, and that's why they think that it's causing blood clots. We've actually had some very young people have strokes because of COVID-19, because of the effect on the blood system. There's been a lot of talk about how COVID-19 as being a disease that only kills old people and only kills people with pre-existing conditions, but young people are not immune. Like I said, there were strokes. A young lady who was 25 years old who got COVID-19 said she had never been so sick in her life. It didn't kill her, but she had muscle aches all over her body, severe sore throat, was too tired to do anything. The thing is that it is a very severe illness in some people, even when they're young, even if it doesn't take their life. And a lot of young people have coexisting conditions that they don't know about. Some they do, but some people have asthma, some people are smokers, some people have undiagnosed hypertension and diabetes, obesity, and other cofactors. A lot of people are not taking the social distancing seriously. On Cinco de Mayo, just a few days ago, we had a lot of people congregating, and that kind of makes us concerned about how the virus can spread if people don't observe the social distancing. The good thing is that we have new medications coming through the pipe being tested all the time. We may be able to find ways to prevent infected people from getting sick and prevent sick people from getting sicker. That may happen in the next few months if we're lucky, but in the near future. But for right now, we need to observe personal protective equipment. Like when I go outside, I'm always wearing a mask. We need to balance. Some people can shelter at home comfortably. Some people can't take the isolation. Some people have to work. If you have to be in contact with other people, frequent hand washing, masking, be careful not to contaminate the outside of the mask and touch it, keeping your hands away from your face, keep as much distance as you can. But above all, remember that God is in control. He can guide our steps and He can help us overcome this. If we use common sense, protect ourselves. We can all get through this.
Thank you so much, Dr. Bonhomme, for that update on coronavirus. Just as we did on Sunday, March 15th with our Q&A, we'd like to invite our viewing audience. If you have questions, we will try to get you answers. Simply call 404-289-4573, option number 4, or text 678-492-0769, or email me at gcsmothers@hillcrestcoc.net, and we will try to get correct, accurate answers to your questions, and we will post those on our Hillcrest website at hillcrestcoc.net. I want to again thank Dr. Bonhomme, thank our HIT team for the work that they're doing, our Hillcrest Information Technology team. But I also want to give a shout out to our the rest of our medical, health and medical team, led by Dr. Iris Buchanan Perry, Dr. Perry Little, Dr. Roland Hamilton, Dr. Ashley Hamilton, Nurse Daphne Gill, and all the nurses, policemen, and other essential workers that we have at Hillcrest and throughout the Brotherhood. May God bless you. May He bless you all really well.